The head of a normal full-term newborn is relatively large. The occipitofrontal circumference measures 33 to 35 centimeters, about 13 to 14 inches. Macrocephaly or microcephaly could be identified abnormalities of variable etiologies. Fontanelles should be soft and non-bulging, with the anterior larger than the posterior. The anterior fontanelle is diamond in shape and measures 2 to 3 centimeters wide and 3 to 4 centimeters long. It lies at the juncture of the frontal and parietal bones and closes about the age of 12 to 18 months. The posterior fontanelle is triangular in shape, small, size up to 0.5 centimeters. It's hard to feel at the juncture of the occipital and the parietal bones. It closes by the age of 2 months. Molding is the shaping of the baby's head. It occurs when the movable bones of the baby's head overlap each other to help the baby pass through the birth canal. Caput succedaneum is a localized pitting edema over the presenting part of the fetus. In vertex presentation, it causes swelling with edema of the scalp. This edema overlies the skull sutures. Caput succedaneum, however, has to be differentiated from cephalhematoma, which is a collection of blood between the skull bone and the periosteum. It results from traumatic labor, and there may be the possibility of an underlying skull fracture. Extension of cephalhematoma is limited by the suture line, where the periosteum is tightly adherent to the bone. Cephalhematoma can occur bilaterally. A cephalhematoma may be liable for secondary infection with pus formation, and hemolysis of the blood inside the hematoma results in hemolytic neonatal jaundice. The neck of the normal newborn is short with increased skin folds. Assessment of the neck for the presence of masses, limitation of movement, or webbing is mandatory. Sternomastoid hematoma is detected as a localized swelling of the muscle causing torticollis with limitation of the lateral rotation of the neck. Clavicles should be palpated for the presence of crepitus, as fractured clavicle is common in large infants delivered vaginally. Note the difference in the site of the swelling between the sternomastoid hematoma and the fractured clavicle. Webbing of the neck is seen in Turner syndrome, while a cystic hygroma is a congenital lymphatic cystic swelling that can be seen in the neck. The face is inspected for symmetry and the presence of abnormal facies or chromosomal features. Examination includes the eyes, the ears, the nose, and the cheeks. Facial nerve palsy results from traumatic birth, and it presents as facial asymmetry. Nevus simplex or salmon patch are pink macular flat hemangiomas. They are usually transient and commonly noted on the back of the neck, the eyelids, and the forehead. They may be most visible when the baby is crying. Most of these hemangiomas fade and disappear completely by the age of 18 months. Salmon patch has to be differentiated from nevus flammeus or port wine stain, which are macular purple or dark red intradermal capillary malformations that are present at birth and remain persistent throughout life. Strawberry hemangiomas, which are raised areas formed by immature capillaries and endothelial cells, and from cavernous hemangiomas. The eye pupils are round, equal, and reactive to light. During the first 6 weeks postnatal, there is transient strabismus, where the baby is not able to focus. The eyes may reveal purulent discharge that requires local antibiotics. Subconjunctival hemorrhage results from stress of the vaginal delivery. In a term infant, the ear pinna should be fully formed, firm, and recoils easily. Note the size and the shape as well as the position of ears in relation to the eyes. Skin tags are harmless, but they may be associated with kidney disease. Inspection of the mouth for an intact palate. Cleft lip or cleft palate or combined cleft lip and palate are well-identified congenital malformations. Epstein pearls are small whitish yellow mucus cysts. These form on the gums and the roof of the mouth in a newborn baby. They are very common. Supernumerary or natal teeth may also be visible. Note the size and the shape of the tongue and the mandible. Abnormalities shown are macroglossia, short frenulum or tongue tie, and small size of the mandible or micrognathia.